Welcome back. Petrol, diesel, milk prices, electricity, and now healthcare. What's common to all of these? Well, price hikes under Siddaramaiah government. Let me explain. The latest to get costly in Karnataka is healthcare. The Siddaramaiah government has put a 20% hike in treatment and diagnostic test charges as hospitals under the Department of Medical Education. The revised rates are now in effect at facilities like the Bangalore Medical College and Research Institute and other autonomous medical institutions across the state. The top government medical institutions are included essentially as well. Essentially, costs for scans, treatments, blood tests, surgeries, all are going to see a hike, in fact have seen a hike. This is across government hospitals, of course. While the Karnataka government continues to cover these costs for BPL card holders, non-BPL patients will feel the impact of this hike, essentially the middle class as well. Here's a quick look at the new rates. Charges for a shared special ward have gone up from 750 to 1,000 rupees. Single bed special ward rates have jumped from 750 rupees to a whopping 2,000. The opposition has claimed that the hike is to fuel the 5 guarantees. Congress claims that these are marginal increases after 6 years.
ಪರಿಷ್ಕರಣೆ ಅಂತ ಹೇಳಿದ್ರೆ ಕೆಲವು ಯೂಸರ್ ಫೀಸ್ ಏನಿರ್ತದೆ ಅದು ಬಹಳ ವರ್ಷಗಳ ಹಿಂದೆ ತೀರ್ಮಾನ ಆಗಿರೋದು. ಕೆಲವು ಕಡೆ 10%, 20% ಈ ಥರ ಸ್ವಲ್ಪ, ಯಾಕಂದರೆ ಎಲ್ಲ ಆಗಿದ್ದು ಈಗ 10 ರೂಪಾಯಿ ಇರೋದನ್ನು 20 ರೂಪಾಯಿ ಮಾಡೋದು, 20 ರೂಪಾಯಿ ಇರೋದನ್ನು 50 ರೂಪಾಯಿ, 40 ರೂಪಾಯಿ. ಅದರಿಂದ ಆವಾಗಿನ ರೇಟ್ಗಳೇನಿತ್ತು ಇವಾಗಿನ ಒಂದು ರೇಟ್ಗೆ ಒಂದು ಹೋಲಿಕೆ ಮಾಡೋಕ್ಕಾಗೋದೇ ಇಲ್ಲ. ಆದರೆ ಜನರಿಗೂ ಭಾರ ಅಂತ ಏನಲ್ಲ, ಜಾಸ್ತಿ ಅದು ಹೊರೆ ಆಗದೇ ಇರೋಂಥ ರೀತಿಯಲ್ಲೇ ಇರುವಂಥದ್ದು. ಅದರಿಂದ ನನಗೆ ಅನಿಸುತ್ತೆ ಇದೇನು ದೊಡ್ಡ ಏನು ವಿಷಯ ಏನಲ್ಲ. ನಾನು ಸರ್ಕಾರ ಏನೇ ಮಾಡಿದ್ರು ಇವತ್ತು ಗ್ಯಾರಂಟಿ ಸ್ಕೀಮಿಂದ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಇದು ನನಗೇನು ಅರ್ಥನೇ ಆಗೋದಿಲ್ಲ. ನಾವೇನು ಏನೇ ಮಾಡಿದ್ರು ಇವತ್ತು ಗ್ಯಾರಂಟಿ ಸ್ಕೀಮಿಂದ ದುಡ್ಡಲ್ಲಿ ಅದಕ್ಕೆ ಮಾಡ್ತದೆ. ಪರಿಷ್ಕರಣೆ ಹಿಂದೆ ಎಲ್ಲ ನೀವು ವಾಟರ್ ಬಿಲ್ಗಳೆಲ್ಲ ಹೆಚ್ಚು ಮಾಡಿಲ್ವ, ವಾಟರ್ ರೇಟ್ ಹೆಚ್ಚು ಮಾಡಿಲ್ವಾ, ಕರೆಂಟ್ ರೇಟ್ ಹೆಚ್ಚು ಮಾಡಿಲ್ವಾ?
All the issues state government, they have actually putting burden on the government, on the common man to actually implement that 5 guarantee programs. For that, unnecessarily they are burdening on the common man. This is not good.
And I'm being joined at this point by Bhaskar Rao, who's a spokesperson for Karnataka BJP, Maya Sharma, senior journalist, as well as Bhavya Narasimhamurthy, who's a spokesperson for Congress. Thank you very much, all three of you, for joining us. Ms. Bhavya, let me just come straight to you first. Ms. Bhavya, the allegation against the Siddaramaiah government at this point is that you're burdening the middle class every few months.
When it comes to price hike, yes, it definitely hurts the middle class. I do not deny it. But you need to take it case by case. When it comes to today's price hike in the government service, health service, I would like to bring some facts to your table. First thing is, this price hike was long pending. For the past 6 years, there was no hike in the government service. The second point I would like to make is, this was important to improve the government services. And the health department recently has brought about some revolutionary schemes. For example, Griha Arogya, where, there are these health services, the tests especially like sugar, diabetes, BP, all of these basic health checkups are being done door to door for seniors, for aged people. Okay. This is only to make sure there are no premature deaths, and this is like a preventive measure. This is a revolutionary step. And then another one, 19 lakh students, female students, will be benefiting from our Shuchi Yojana. These are some of distributing menstrual cups and sanitary products. So these are some of the revolutionary measures the health department is bringing. And this particular price hike is very marginal compared to the services people are getting. When it comes to BJP, they're always after our guarantees. They're against the socialistic principle and welfare schemes that everybody knows. So any price hike, they want to bring in guarantees because they don't like poor people being given, making them financially independent, or making sure Karnataka goes hunger-free
No, but
through
the question
Annabhagya,
is not
or
about
women, getting free
doing
bus rides so that they are
something for
socially
those
empowered.
who cannot afford.
No,
The question
I'm just
is,
going to finish.
are you doing
Yeah.
things that are draining the middle
Yeah.
class? The two things are very different. And sure, please, by all means, do all that you can for those who can afford and not afford.
Draining the
But
middle
are
class.
you straining is the question. But let me first straight go to Bhaskar Rao. Bhaskar Rao, do you agree to what the Congress spokesperson has said?
It is a very cruel, unplanned atrocity on poor people of Karnataka. This government has always been increasing the prices of several commodities, right from milk onwards, gas, etc., etc. Now it is planning its next hike is the transport hike, which is going on the cards over there. And Bhavya Narsimurthy knows very well kind of services that are provided. It is availed by the poorest of the poor people. Not only that, they are now cancelling the BPL cards also of number of poor people, and they left people high and dry just because they have got a brute majority of 136 members. It is some kind of a cruel joke being played on the poor people of Karnataka. And if you see, the state's primary responsibility is to provide good health and good quality education. Now, Bhavya Narsimurthy probably is not aware that BP, sugar, etc. are very elementary tests which every government is obligated to provide to its own citizens, whether they're old or whether they are young. So increasing this kind is a very cruel step, and it is a slap on the face to the poor people who have given such a huge mandate to the Congress. They should be withdrawn immediately. If you have seen, the government in Delhi has come out with so many schemes for senior citizens, which is absolutely free of cost. Providing good health is the foundation, and the next generation is going to be healthy only on the basis of the kind of health services that we provide.
Well, that's
By
interesting.
charging
That's
and
interesting.
saying I'm going
BJP
to
is
give
taking
good
the
services,
example
etc.,
of a
is
Delhi
not going to
government.
cut
That's
any
very
ice.
interesting.
This should be
That in
absolutely
itself is very
free
interesting,
for
but
the
I'll
poor
not
people
steer
of the
away
state.
from the topic at this point. Allow me a minute. Allow me a minute. And I know Ms. Bhavya wants to respond to this, and Maya Sharma is as well there. But
Can I
very
just,
quickly, give me
respond
a
to that?
minute. Let's listen
Yes.
into what people in I'll come to you, Ms. Bhavya. I will be coming right to you next. But let's just listen into what people of Bengaluru have to say about this.
Sure.
पुअर पॉपुलेशंस के वास्ते खासकर ये जो इंक्रीज करको ही फर्स्ट उनकी एनुअल इनकम क्या है वो देख के बात डिसाइड करे तो गवर्नमेंट भी वो अच्छा रहता। मगर पहले उनके पास पैसे नहीं रहते गरीब लोगों के पास, और वो इतना चार्ज करे तो इट्स वेरी डिफिकल्ट फॉर देम टू हैंडल इट।
इसका बहुत असर पड़ेगा, क्योंकि 10 रुपए का 20 रुपए दे सकते हैं, 7,700 का 750 का कुछ 2-2,500 रुपए दे नहीं सकते गरीब लोग। ये बात है, उतना ही आएंगे। प्राइवेट में और ज्यादा है, प्राइवेट में और ज्यादा है, दवाई का इसका उसका और ज्यादा है। इधर ही आएंगे और किधर जाएंगे?
I think if they increase prices and even in government hospitals, people from middle class or low middle class, they will have nowhere to turn to.
वो तो क्या भी तो ये कर रहे नहीं, जो गवर्नमेंट बोलेंगे वही करेंगे। हमारे पास तो बीपीएल कार्ड नहीं है तो हमको पैसे लग रहे, जिसके पास बीपीएल कार्ड है उनको पैसे नहीं लग रहे, तो हमारे पर ही ना लग रहा। हम बना देते तो थोड़ा कम लगेगा, हम नहीं बना के है, हमारी गलती है ना। वो बीपीएल कार्ड कैंसिल कर दिए तो बहुत तकलीफ हो जाएगी, इतना तो पैसे भर के तो कोई इलाज ना करेगा।
Ms. Bhavya, look at the timing of what's happened. So you are saying the cost that has increased is very marginal. But look at what people are saying. Their salaries have not increased. Their source of income has not increased. Studies that even the Congress is quoting nationally is showing about the shrinking consumption patterns across the country, because it seems that something is not well in the Indian economy. There is a pushback of all sorts. And at that time, you're actually going ahead and also increasing the charges and the prices at the hospital. So you have milk, you have electricity. I mean, of course, the transport thing is still under purview. We don't know whether that will happen or not. And there are several others up on your screen as well, Ms. Bhavya. Guarantees are becoming a big burden on the middle class. It's hard to shun this.
Can you please explain how guarantees are becoming a burden on the middle class? Because there are the same middle class are
I
also
don't know.
the
You will have to
beneficiaries of the
explain. I am not
guarantee
here to
scheme.
explain. I am asking
Whether
a
it
very
is through
general
Shakti
question
scheme.
because including Chief Minister
I'm not
Siddaramaiah
making
has
a
said that
statement. I'm not
no,
making
hold
a
on, Ms.
statement
Bhavya,
that
because you've asked me
guarantees
a
are a
question,
burden
I'm
on middle
replying.
class.
Otherwise, I would not
I didn't make
respond.
the
I would allow you
statement.
to speak.
The BJP
There's no
and you, the
point of
media, are
asking
making
me
the
a question
statement.
and not allowing me to speak,
Exactly,
Ms. Bhavya.
exactly.
Ms. Bhavya, if you've asked me a question, I have to respond.
That's because
Ms.
you made
Bhavya,
the
if you've asked me a
statement. You
question, I have
made
to
the
respond.
statement,
I
which
am
is-
not saying this. Chief Minister Siddaramaiah has said
Guarantees,
that the
middle
burden
class
of the
are
guarantees is
also
being
the
felt on the
beneficiaries of
exchequer.
guarantees.
Prices have been increased. So my simple question is the middle class being burdened? You don't have to ask me a question back, but please go ahead, Ms. Bhavya.
Whether it is middle class or the poor people, the way BJP is making statements and the statement you just made that they have been burdened, let me tell you, our guarantee schemes are also targeting the same beneficiaries. One thing, but let me complete it before you come back. But just now, it's easy to mislead on the media, just like how Bhaskar Rao sir just said, the BPL cards have been snatched away. Let me make it very clear. The new rules that the central government has set as a qualification for holding BPL cards, they are being implemented. And in case genuine and deserving people are denied of the BPL card, they can again apply and get their BPL card. It is very clear, none of the deserving and the genuine people who deserve BPL card.
There's no doubt that the BPL is being covered by it, and if you are worthy of BPL, you will get the card. The question is about the middle class. You're missing the question, and that's why I'm bringing this again and again.
One second. There is, for those who have BPL cards, there is Arogya Karnataka, there is Ayushman Bharat, there are so many central government insurance schemes, health schemes that they are deserving for the deserving people. And even here, the price hike is
okay, let me get in Maya Sharma at this point.
I know, and it has been pending for the past 6
Maya
years.
Sharma.
In the past 6 years, I'm not sure, I don't think the salary
Maya Sharma,
has not
how do you look at all
right?
that? I mean, you hear the Congress spokesperson speak. You hear what's happened. Mr. Kharge has gone ahead and actually spoken in public. He has told his governments, including the Karnataka government, that listen, don't promise what you can't deliver. There have been series of hikes. In fact, Congress at the national level has at one time even gone and during the elections campaigned about the increasing prices of essentials and so forth. Healthcare is just that. So what's the picture? What's the real picture, Maya Sharma, in Karnataka? What's happening?
Well, of course, any hike in prices will not be welcomed by the people. You and I have asked, every time there's been a petrol hike, we've gone to people and said, what do you think about it? Any hike is not welcomed, whether it's at the poorest of the poor, the people who are using the government hospitals, or even the people who are reluctant to pay more for a air purifier in Delhi where you are because of the GST hiking the prices. In this particular case, it's very difficult because who uses the government hospital services? It is people usually who cannot afford to go to private hospitals. The Congress government here is saying that they are taking care of those who are BPL, that those below the poverty line will continue to get free treatment, and the directors of these medical college hospitals where this applies will actually have the provision of providing free treatment if the patient cannot afford to pay. They say they are protecting the poorest of the poor. But those a little above the poverty line, those who are going to the government hospitals. Now, for us, being privileged, we may think a hike from, I think, admission for whether it's registration for an OPD or whether registration for inpatient, it's hiked from, say, 25 to 50 or 10 to 20. That may seem negligible to us, but for people who are earning, for daily wage earners, for people who are living day to day, those are not insignificant sums. So, of course, it is hard for them. The government, although, does say it is doing it because it has been years, 5 or 6 years since the last hike. The prices are going up for everybody, for the government too, that the services being provided cost more. And they're also saying that I think the money which is coming in from this hike will stay with the hospitals in order to improve services. And we also must remember that politically, the opposition will always oppose. I mean, we've covered from both sides, whether it's the BJP hiking prices or the Congress hiking prices, the opposition will always say, this is not fair, you're hurting the middle class, you're hurting the poor, which is why these hikes never take place before an election, but usually just after an election. So politics continues. It's a difficult time for the people, facing inflation, but the government insists it is doing this. It's a minimal price rise and that it will benefit the hospital's function. But of course, for the people were earning daily wages, it is hard.
That's right. Thank you, Maya, for that. In fact, let me just take this to the panelist at this point. You know, Ms. Bhavya, you heard Maya Sharma speak. Very quickly, 30 seconds, respond to this. And then I would like to go to the BJP panelist.
Whenever there was price hike during BJP, although they didn't give any guarantee schemes, there were every time a new government comes and with time the inflation and even the salaries rise and the price rise happens. But to blame guarantee schemes for everything is not something acceptable, because we have given it a thought and now the guarantee schemes, since the day we promised and we implemented it till now without a break, we have made sure that it has reached the people who deserve. So why bring in guarantee schemes every time there is a price hike in any of these commodities? Was there no price hike during BJP? There was always, in fact, the price hike during BJP government is much higher.
You are targeting the Congress, haven't you done the same?
Madam,
Hasn't it been the same story in yours? And if the inflation is going up, isn't a price hike or hike obvious? But how do you look at this argument? I mean, it's not like BJP has not done it in governments when in power across
price
states.
Hikes are, I agree, price hikes are inevitable. But this is a very cruel price hike coming at a time when the price of petrol has been increased, milk has been increased, electricity has been increased. And then in the name of guarantee, what they say, we'll give you some money. And again, they take it back through the hikes over there. And as Maya Sharma pointed it out, that this is meant for the poorest of the poor who are having a hand-to-mouth existence. It is clear in directives and principles of state policy, as well as the state is mandated to provide quality health care. By this hike, they are not going to get much. But definitely, the hike is very cruel and it should be withdrawn immediately in the interest of the poor people who are already reeling under extreme price hike of other commodities are concerned. So this hike should be withdrawn, and I never talked about guarantees. It was Bhavya who herself started defending the guarantees before I could say anything about guarantee. So
no, BJP has spoken about it. JDS has also spoken about it. So it's not like Bhavya herself started talking about it. The opposition has targeted the Congress over this.
Going on account of this guarantee. So the lesser said about the guarantees better, because the guarantees are not getting implemented. Bus prices are getting curtailed. Money is not reaching people over there.
Okay, Maya Sharma, let me come very quickly to you. The last word to you. Would it be fair to say that across the spectrum, it's the middle class really that's bearing the brunt of it? Because if you have a lot, you can dole it out. If you don't have, you're being covered under the schemes, and then you have the middle class in between.
Oh, absolutely. With the prices rising, with the cost of goods increasing everywhere, and from essentials like fuel, electricity, milk, it is really the middle class which is facing the brunt. And like we spoke some years ago of India's powerful growing middle class as being a huge market for whether it's foreign companies working here, whether it's for the Indian market alone. But we are seeing people being far more careful with the way they are spending. We are seeing consumption levels coming down, not of course among the super rich, but among the middle class who are living salary to salary, who are trying to make both ends meet in a world where the prices just seem to be increasing. It is definitely, we are talking also about a shrinking middle class in India, that maybe the dreams, the hopes of a growing middle class which would fuel economic growth is not really happening, that the numbers of people who could be defined as middle class is actually shrinking in India, with more being pushed into poverty by rising prices, something definitely which people are facing across the board.
I think that's really the timing. I wish I could go back to Bhavya to ask her about the timing of it, and I've asked her earlier as well. But nonetheless, we're totally out of time in this bulletin at least. Bhaskar Rao, Maya Sharma, as well as Ms. Bhavya, thank you very much for joining us. Nationally, as well in states, the middle class are bearing a brunt of all, particularly as there are signs of possibly the economy as well being in kind of doldrums or slowing down. And possibly the timing of this is a big question at this point. Thank you very much for joining us, all three of you.